On renal failure, there is a various type of renal diseases. The first cause I would like to show you, that is anuria. Anuria means there is no urine, absence of urine, there is no urine output. This is a case of a boy which is just 15 years old and he hasn't passed urine since last 5 days. How many days? 5 days. So anuria is a medical emergency. If you are not going to treat the patient within time, there would be chances of uremic coma and permanent renal damage. There are drugs, there are medicines in homeopathy to treat this kind of conditions. This is a condition, sometimes this requires catheterization or some acute dialysis or some, in allopathy they are using some diuretic medicine. Everything they had tried, but the boy hasn't passed single drop of urine since last 5 days. So just imagine the threat of this case. And I am treating these renal failure cases, even cardiac failure and liver failure cases since last 16 years. But this is also one of the interesting cases. It's a 5 days anuria, it's not a little much, no. The interesting thing is that in this case, the bladder was not distended at all because there was not a single drop of urine inside the bladder. So there is no question of catheterization. Because if there would be urine collected in the bladder, then there must be bladder distension. And bladder distension is a very painful feeling. But in this case, the bladder was totally empty and the ureter was also empty. There was no production of urine, a single drop from the both kidneys. So he undergone some, he had some previously history of this anuria for 1 day or 24 hours, 20 hours. But it was corrected with some allopathic medication, so giving some diuretic. But this time the boy doesn't show any response to any diuretic or any allopathic medicine. And then the nephrologist suggests him to do the better way, dialysis. Because if this condition could be persist, there is a chance of acute tubular necrosis. And once this condition is occurred, there is a permanent loss of the kidney parenchyma. So, a very interesting case this. I would like to show the interesting case of boy age 15 suffering from anuria since 5 days, which is an acute medical emergency. In October 2009, that before 9 months, the patient suffered from anuria. He did not pass urine for about 24 hours, and other than this, apparently he had no other complaints. He was then taken to nephrologist and after treatment he passed urine. But after a symptomless phase of about 1.5 months, the symptoms reoccurred, for which he was given the same treatment. Such episode recurred for about 3-4 times more, for which he had consulted topmost nephrologist of the city. Along with this, he also suffered from slight pain in the bladder region with urinary disturbance since last 9 months. Another striking feature of this case is that within 2 months since October 2009, suddenly he had gained 5 kg of weight. There is an increasing of weight because there is a water imbalancing inside the body. The urine output is very low, that's why the weight is increasing. Before coming to me, he was suffering from anorexia since 5 days and was not responding to the conventional treatment. Even the nephrologists were not able to judge the exact diagnosis, and through that the symptoms may be due to hormonal imbalance. But at the end, the exact diagnosis was not made, and still the fact that the patient had not passed the urine since 5 days. So this is the introduction of this case. Patient come with 5 days anorexia, and I'm having indoor hospital there. That's why I took this kind of cases. After consultation, my student had taken the consultation, junior student, and then at midnight, means at 2:30, he came in front of me with the same condition. He was sitting very silently, not giving any correct answers, just keeping quiet, just like aversion to any answer, like that. Very sluggish, very dull, very lethargic boy, with you can say a very pale and muddy face, silky face, and all these symptoms are due to the retention of urine and sodium imbalancing, electrolyte imbalancing. Everything was there. So the case taking starts at midnight after 2:30 a.m. This is the condition of this boy. You can observing the ring around his cornea. No? There is a white ring and there is a muddy color link, no? Around the cornea. You are observing? This ring shows there is a sodium imbalance in this person. If your clinical is good, you can judge this case that yes, it is a renal failure case. It is a renal, what you can say, disturbance case. You see, just around sodium ring around this cornea, and there is a yellowish brownish ring around on conjunctiva around cornea in the both eyes. Also, he had a chronic conjunctivitis complaints. He had complaints of lacrimation also. Anyway, so his investigation, ultrasonography shows echogenic area 3.8 mm in prostatic urethra in the likely to be calculus. In 17/12/2009, the sonography report, echogenic shadow in the posterior urethra, impact tiny calculus in wall of urethra, inflammatory lesion, ultrasonography of KUB region on 27 Jan 2010, chronic cystitis with wall thickness and wall edema. This was the previous diagnosis on the sonography.